Greetings, everyone out there. Welcome to another educational round here presented by Seclair. My name's Jim Ellermeyer, and I'm a behavioral health therapist at Seclair, and I'm joined here today by my colleague.
I'm Erin Fitzpatrick. I'm a PA student from Seton Hill University.
And today we're grateful to be joined by Jim Donovan. I'm going to let him talk about yourself, but I was really excited when Sven, my good friend Sven, informed me this morning that we had a possibility of having Jim on the program today. And all days are good. Some days are better than others, and this is a better than other day. So I would like to introduce Jim Donovan and let him tell a little bit about himself.
Sure, thank you very much. Yeah, my name is Jim Donovan, and I'm currently chairman of the Fine Arts Department up at St. Francis University. So we're up in Loretto, PA, up on the mountains. Prior to my life up here as an academic, I played in a band for about 15 years in Pittsburgh, a band called Rusted Root, and we had a song called "Send Me on My Way." I like to lovingly refer to that song as the song that bought my house. And yeah, so we did quite well. We had a good decade and a half of touring success and recording success, and got myself off the road and started really trying to share some of the things that I learned as a performer. One of them being the power of drumming, the power of group music making to connect people, to help them to release their stress, and even help them to improve their sleep, believe it or not. So this is something that I do now. I train people to work with others who are experiencing things like that.
For those who are unaware of what Seclair is all about, we're an integrative, holistic psychiatric facility where we do not paint people as depression, anxiety, bipolar. We look at the person as an individual, look at them in every aspect of their lives, and consider that when we're helping a person to assist them in dealing with life on life's terms, Jim. And as it's clear here, of course, we do take a medicinal outlook on things. However, what we tend to view medicine as there's the airport where we're trying to assist a person on being their own therapist. And do they want to walk there, or would they rather ride to the airport in a car? And what we try to do here at Seclair is offer as many alternatives and enhancements to a person's life that can be possibly made available to them. Could you share a little bit with us about mainly a lot of the presentations here at Seclair are dealing with anxiety and depression. Could you tell us a little bit about how you got interested in using music and drumming as a therapy tool?
Yes, it really stems from my own personal experience as a performer. One of the things I was afforded the ability to do every night was to release energy. So for me, I played a drum set, and every night was a catharsis where I got to go absolutely out of my mind, play as hard as I could, sweat, and always, though I'd be tired, I would always feel better. And what I realized, and what I over time had always wanted, was this to find a way that I could bring the audience into the music making, because I knew how powerful it was for me. And the block that always came up was, well, there's a lot of people that really aren't quote unquote good at music. And so what I've done was to set out to find a way to bring everybody, everybody who's willing is the phrase I like to use, into the music making. And that's the system that I teach. I've been teaching for about the last 15 years. And what I see over and over again is that even if someone isn't a quote-unquote trained musician, they can have a cathartic experience that helps them to feel the connection. It helps them to release energy and stress and tension, physically, mentally, and emotionally.
Could you share with us some of the scenarios where you found this to be effective, maybe some anecdotes out of your own experience?
Yeah, absolutely. There is a technique that I use really everywhere I teach. I call it the stopwatch tap, and it's something that I use in addiction recovery. I use it with my college students. I teach it to them to use before tests. I use it with my kids anytime they're anxious, and I use it for myself. For years, I experienced and suffered with anxiety disorder, where I would have panic attacks and feel the heat and the pressure of all that stuff building up. And what I found is that just moving the hands back and forth to the speed of a ticking stopwatch on a drum or even just on my lap for about 120 seconds slowed the speed of my brainwave down and put me into more of a state of coherence, so that I wasn't experiencing the anxiety any longer.
And it must be a great sense of relief and a connection, a bond between you and these folks when they found out that you've traveled down that road also.
Absolutely, it's one thing to say something is good. It's a whole other thing to have experienced the challenge that so many people face and have some success with it over and over again.
Indeed, and here at Seclair, we also deal with people with various type of addictions. And could you tell us a little bit about what type of the drum is a modality for dealing with people with addictive disorders?
Absolutely. I work at a place in Maryland. I'm consulting at a place called Maryland Recovery Partners, and they brought me in. They've brought me in a few times now, and now I go down there every month. I work with people with heroin addictions, alcohol, pills, anything you could imagine. And what we see in a lot of these folks is that um, they come into these experiences, having some confidence problems, not really feeling very powerful, especially if they're in a rehab. They're probably the worst that they felt maybe in their entire lives. And what we're able to do in a pretty short period of time is to take these folks and give them an opportunity to experience creating something together with others. Now, this is something that a lot of folks don't realize that they can do. But what we see is that when they're given permission to make mistakes, so we fail proof experiences with people, and we give them some real basic tools, some understandings, and some freedom, that they experience a range of really positive outcomes. Everything from just interacting with others, so not isolating, to giving them a sense of accomplishment, so boosting confidence, lifting them out of the depressive states, really increasing their vibration, if you will, and also just helping them to experience peace of mind. These are just some of the many benefits that we get from drumming. Um, Interestingly, this is something that's been happening all over the world for tens of thousands of years, and we here in the West are just really rediscovering the power of it.
Well, it's amazing sometimes when we get people that are just steeped in Western allopathic medicine, and when something works. One of the core modalities we use here at Seclair is mindfulness, and I get a little laugh when I find out that people in the West start to understand that maybe these things do work, and then they believe that they discovered them.
Yeah, I'm happy to let them think that. As long as they...
Erin has a few thoughts she'd like to throw up in the air, Jim.
Sure.
I know we talked a little bit about the anxiety and like the panic and even the addiction that can be helped with drumming. What other like diseases and disorders have you seen that have received a lot of benefit from using it?
That's a great question. I should start it by just saying that and I know that you all know this, but maybe our listeners don't, is that stress is a key component to so many of the diseases and disorders we've got. And in fact, people of the college-age generation are said to be among the most out for as long as we've been recording stress levels. And what we know about this is that we're also seeing incidences of people younger and younger in the hospital with things like heart disease and stroke and diabetes, diseases that used to be, especially heart and diseases that were diseases of old age. Now we're seeing people in their late 20s and 30s in the ER with these, and we're attributing it to unchecked stress. So that just to start it out with that. The other thing that I have experience with here at St. Francis is we studied the effect of rhythm on children on the autism spectrum disorder, and what we were able to show is that we were able to find an increase in these kids' ability to stay on task. So increase attention to task is what we were studying. And what we found was over a period of 10 weeks, we sent occupational therapists, to work with these kids as we do every week with techniques that I showed them, and they showed an average increase in attention of 189% on average. We had some kids, some of the outliers, who went from being able to pay attention for seconds, which is common, to minutes, which typically developing kid doesn't seem like that big of a deal, but for kids on the spectrum, it can be a matter of learning something or not, because to learn something we need their attention for longer. So those are the two main things that I have experience with.
Can you relate to college-age stress?
Oh, yeah. Yes.
Erin's in her rotation part of her training as a physician's assistant, and at this point, Jim, it's more of an endurance test than a learning experience.
I bet.
So we were talking before we came on today about the vibrational aspects of music,
Yes.
drumming, any type of music, and the connection with the universal experience, and the different types of energy connections.
Yes. Something I love talking about, and so interrupt me if I go on too long. So the way I think about sound, a simple way that I think about it is that sound is vibration, and vibration is movement. When we have a constriction, so a headache, or if we've got anxiety, sometimes I feel like my chest is sort of heavy. We utilize sound to essentially move constriction. If you've ever had a sore muscle, like from drumming, sometimes I get sore right here, and my tendency when I'm sore is that I want to move the muscle, right? Because it opens the constriction. Sound does exactly the same thing, except it does it on the subtle level. It does it really from inside the body, whereas my hand is outside. When I make sound, whether it's I say a mantra, or I just make the sound of the letter M, I'm creating a vibrational or a movement of vibration through the system. And what we see is that when we do this, we can really affect the physical body, the emotional body, and the mental body in a very short period of time. In fact, a lot of the things that I teach are some of these techniques are just 2-minute techniques, so 120 seconds can shift the nature of how we're experiencing reality, and that comes from intentional creation of vibration. So we use the voice, we use the drum, and we use the connection of mindful intention.
Excellent, excellent. And again, what I work with a lot with the patients that I have is on focused attention and experiencing the present moment. And drumming music can certainly do that. Anything else here? Jim, could you tell us a little bit how people could get in touch with you, and perhaps some of the events that you'll be either holding or appearing at in the near future?
Yes, I'd be happy to. The best way to get a hold of me, I have 2 websites. One is just my name, so Jim Donovan, Donovan, and the word music, jimdonovanmusic.com. And the other one is drumcircleleadership.com. if anyone's interested in learning how to facilitate group music making, I offer trainings to people that do just that. So I teach people how to do what I have one of those trainings coming up here. If you're in the Western PA area, it's a 45 minutes south of Pittsburgh. It's a retreat called Laurel Pleasant, and that training is happening October 10 through the 12th. It's called Sound Empowerment Training, and you can find all the information about that at drumcircleleadership.com. The other event,
that's really great stuff. Anything else, Aaron? Well, wonderful, wonderful. Well, we'd certainly like to thank you for joining us today, and we'd love to see you out here at Seclair in the near future or whenever you're available, Jim. Love to see you.
Let's
out
make
here.
that happen. It'd be a lot of fun.
And I'll ask Aaron to close us out.
To continue this conversation, please like us on Facebook, plus us on Google+, or follow us on Twitter under Seclair Life, and keep an eye out on any of these for our next live recording Mondays around noon to ask your own questions. You can also find this and other Grand Rounds on youtube.com/SeclairVideo, and find audio versions on iTunes, Stitcher, Speaker, and iHeartRadio. And please visit www.seclair.com for more about us and other articles on our great blog today.
And again, I'd like to thank our guest, Jim Donovan. Please follow his links, and please continue to follow us here at Seclair. And as my good friend Sven and I often give a prescription out every week, fruits, nuts, and vegetables, perhaps unplug your TV, perhaps take out fishing, and for a real mindful experience, you can come fishing with Sven and I, and we call it fishing without bait. Until next time, thank you for joining us. And you're off.